Colorectal cancer is one of the most diagnosed and deadliest cancers in Arkansas among both men and women. But one of the best ways to combat it is with screening and early detection. In 2021, Arkansas law recognized the U.S. Preventive Services Task Force recommendation, which changed the screening age for colorectal cancer from age 50 to 75 to 45 to 75. And the Arkansas law also requires insurers to cover screenings, including follow-up colonoscopies, at no out-of-pocket cost. And we know that advanced screening saves lives. We also know that too few Arkansans take advantage of them. To learn more about the importance of colorectal cancer screenings and the danger of delaying screening, I'm joined by Dr. Thomas Kang, a colorectal surgeon at the University of Arkansas for Medical Sciences, Winthrop P. Rockefeller Cancer Institute in Little Rock. Welcome.
Thank you. Thanks for having me.
All right. To begin with, help us understand just how important it was to lower the age for the screening.
Yeah, that's a great question. So as you mentioned, the screening age has been lowered from 50 years to 45. Mm-hmm. And we know that the age of diagnosis for colon and rectal cancers has been getting younger and younger in our population. So I think overall this is going to bring about a very positive change.
Yeah, well, I turned 45 last year and I made sure to go and get my colonoscopy.
Oh, yeah, perfect.
Everybody do that.
Yes.
What do you think is driving the increase in colorectal cancer among younger people?
So studies seem to suggest that it has more to do with genetic and inheritance factors. And there are lots of other risk factors to developing colorectal cancers like diabetes, sedentary lifestyle, smoking. However, as we all know, association does not always mean causation.
Right. And
in younger population, we just have seen an increased proportion of patients who have an inheritance pattern with colorectal cancers. You know, that's just an ongoing topic of investigation.
And it makes it important to screen. So what options do we have for screening? I went straight for the colonoscopy, but I know there are others.
Yes. So colonoscopy is generally considered a gold standard. However, there are many other options like virtual colonoscopy, we call it, or CT or MRI colonography. There's obviously fecal occult blood test with flexible sigmoidoscopy. There's also FIT test, or there's a Cologuard test, which specifically looks at tumor DNA within the stool sample. The caveat to all those tests, other than the colonoscopy, is that if something comes back positive on any one of those tests, really you're headed down for the colonoscopy anyway.
Yeah.
And the good news is, in an average risk patient, after a clean colonoscopy, you don't have to come back for 10 years, whereas all those other tests are at a shorter interval.
Okay. We know that we have disparities among certain populations on a number of different health outcomes in our state. Is that also the case with colorectal cancer?
Definitely, yes. So I did my fellowship training at the University of Alabama in Birmingham. And when I came down to Birmingham, I became very aware of the disparities that are facing our patients in the South, which was a huge key factor in my decision to wanting to work at a place like UAMS because I wanted to make a difference. And there's just not one thing that says, oh, this is what we need to address in order for our patients to get better access to care. As you know, it's societal, some of it's psychological, some of it's just a pure physical distance to the hospital too, you know. And we have, thankfully, community providers who can help guide those patients to a center like UAMS, where we have multitude of specialties who can that can help these patients and serve them for the better.
So when you're talking with patients, has there been just this aha moment that really conveys the importance of early detection? Certainly better than you and I just sitting here talking. And
sure, yeah. The youngest patient with colorectal cancer I've seen during my time was probably in her 30s. Younger patients also often tend to present with metastatic disease, widely metastatic disease. We also know that in younger patients, the diagnosis of colorectal cancer can be delayed sometimes several weeks up to even 2 years. it's just many encounters with patients that helped me realize what an important job that this is to make sure that patients get screened properly.
Well, we thank you for joining us today and raising awareness about colorectal cancer. For more information about colorectal cancer, you can visit our website at achi.net. And for more information about Dr. Thomas Kang, you can visit uamshealth.com.